Hi, my name is Aqib Elahi, and I'm the Diabetes Health Educator for the NHS Diabetes Prevention Programme, and I currently cover the Hampshire and Isle of Wight region. I'm very passionate about supporting patients to live a very healthy lifestyle who live with pre-diabetes, especially those who are from a BAME background. As you know, people from this ethnic minority background are more predisposed to type 2 diabetes and its complications. Before getting into this role, I did my master's degree in diabetes best practice from University of Southampton, and in my master's program, I was able to do my own dissertation project tailored to South Asian people living with type 2 diabetes. In this project, the purpose of this was to understand the lived experience of South Asian people living with type 2 diabetes and understand their feelings and thoughts of the treatment regimen they're receiving, and also how they generally feel living with this long-term condition. So I was able to interview patients in the Southampton community, and what I found was, from my patients interviewing them, was that wasn't much culture in the healthcare services they received, not much understanding of the culture when it comes to prescribing medication, the treatment regimen, and really having that understanding of the culture, the background, and the religion side of things. And that's really helped me as a healthcare professional to use this information into my daily practice, where I can take it to the next level and add in more diversity to my clinical practice. So since joining my role as a diabetes health educator, I was able to add in more diversity to the current team. And since delivering sessions to my patients, there wasn't much diversity in the room. And I'm from Southampton, and Southampton have a large BAME community. And not seeing much people from that ethnic minority backgrounds in the program was concerning. So part of my role, I had the privilege to work alongside with Southampton City CCG, alongside with my program manager and colleagues in the CCG team. And we both share the same aim to increase the uptake of BAME people in the NHS Diabetes Prevention Programme. And we were able to, identify the BAME people living in the Southampton and Portsmouth communities. And also we were able to target GP practices that have large numbers of BAME patients. So again, I had the privilege to be the front face of the NHS Diabetes Prevention Programme, where I'll be attending at lunchtime GP practice meetings, and where I'm able to liaise with healthcare professionals on how to refer patients, what we offer in general, and how we can increase uptake of BAME people into the service. Also, I'll be attending target days events alongside with my program manager, where I'm able to hand in more resources, more leaflets, and basically having that interpersonal relationship with diverse healthcare professionals of how they can refer their patients into our program. Other than that, I've been doing a lot of community work in Southampton. So I'll be attending health events that's exclusive to BAME people. For example, I attended the event in Southampton exclusive to Black African Caribbean people in a local church. I'll be attending community events in Southampton, such as the Southampton Miller, that's exclusive to the BAME communities, and also I'll be attending the religious events in the local mosques and gurdwaras. We are able to do some short talks on explaining what is type 2 diabetes, why do the BAME people have such high risk factors of this long-term condition, and especially in the South Asian events, where I was able to talk about coming from the ethnic minority background, the risk factors can be quite high, and also people from the South Asian background can have insulin resistance at a very young age, which is again a very increasing concern. So that's really helped people from the BAME background to open their eyes a bit more and understand the condition in a better context, where we are able to take action into coming into the NHS Diabetes Prevention Programme. So in a nutshell, we were able to, with the hard work we've been doing, with the CCG team, we have launched our own sessions exclusive to South Asian people, and that's delivered in a language in Urdu, Hindi, and Punjabi, and that's delivered by myself. And again, I'm privileged to be the BAME lead educator for this project. And basically now I'm able to see more South Asian people in the service, where I'm able to speak in a language they understand. I'm able to tailor the healthy eating side of things, the snacks, the drinks, and the general lifestyle and religion to the South Asian people, where they're able to, tailor the lifestyle changes into what works for them. And that interpersonal relationship with all my South Asian patients, where they are able to open up more from the group, they're able to share the challenges, they're able to share what's working well for them. That's also good to see this in the service. Other than that, to showcase our success story, my patient Hardeep Sohal, who completed all 13 sessions of the program, she also reduced her blood sugar levels, and her HbA1c blood test has shown to be normal range. And we were able to put Hardeep Sohal into the case study, where it showcases to the South Asian community that you don't really need to sacrifice your diet, your lifestyle, and all it is about managing healthy eating. Is about cutting down on portion sizes. It's about managing your mental health. It's about managing your weight, and that can really make a big difference in reducing the risk of type 2 diabetes. And so we need more awareness in the community, where we can have someone like Hardeep Sohal as like a role model, or like a diabetes champion that can really relate to other people from a certain background, that if Hardeep Sohal can do it, you can do it. So since COVID-19, we know we are in the middle of a pandemic, and it's having an emotional toll on people around the world, especially from a BAME background, where they are twice as likely to die from the COVID-19. So again, this is becoming an increasing concern for the BAME people, because they are more likely to be affected by coronavirus than other population groups. And on top of that, the underlying conditions that they can be more predisposed to can add in more further challenges. So we're very fortunate enough to still continue the NHS Diabetes Prevention Programme online, where we are doing it through Zoom platform, and everyone can take advantage of the sessions online. To be eligible for this program, you will have to go to Diabetes UK and do a quick risk score assessment, and that if that comes up as high risk, then you are automatically can refer yourself to the program. All you need is an internet connection or a telephone. We can just dial in, and from there you can just take advantage of the sessions that help you reduce the risk of type 2 diabetes and other other conditions such as high blood pressure, high cholesterol, and it can also reduce the risk of cardiovascular conditions. So it's basically you get a full package of that, including managing mental health. Which is great to still continue the journey online. We can still, in the middle of a pandemic where people are more worried to go out, more worried about being affected by COVID, especially those who are living with underlying conditions, and having the service online can really help them manage their weight, stick to healthy eating, portion control, and also improve their mental health.